about you, just the thing I like about you.
Well, welcome to our 11th annual Long Island Youth Safety Coalition Youth Conference. I can't believe it's been 11 years. I'm Renee Fischer. I direct community affairs for the DA's office and chair of the coalition. It's absolutely incredible, the turnout. I want you to know that every year we've been a little bit bolder and taken risks in developing our conference, and we grow that way, and of course we make mistakes. So we're going to make a lot of mistakes today, and that's why I think we're as good as we are, and we're going to count on you to give us friendly, supportive feedback on what went well and what didn't, so it can continue to be. You know, this morning I woke up and my new girlfriend Alexa, I asked her, you know, like what was happening, and she told me about what to wear, where to go. But then I asked her about the news, and I was shocked to hear that this morning, as we are here, 8,000 families in California have been evacuated because there's an out-of-control fire sweeping through Ventura County. And it dawned on me how quickly things can change in your life, and how fast it is, how vulnerable we really are, and how vulnerable this generation is. And I'm thinking, we have our own firestorm here in the United States and on Long Island sweeping through. The most obvious is obviously the substance abuse, but there's more than that. There's suicide, there's bullying, there's all kinds of crises going on. And so as the district attorney's office, we want to partner with you and try to give back. This is a resource conference. We want you to take advantage of our speakers. You'll see we're not loading you down with pamphlets and brochures, because you can go on our website and get them. And so at this point, I'm telling you, we have a really, really packed day, and we're also very proud to be able to give you the education credits. This is the second year we've done it, and we've expanded it. We have a lot of people to thank, but I'm going to get to thank yous later. All right, as I said, I'm one of the district attorneys, and I've been here a long time. I've worked with 3 district attorneys, and it's a major seismic shift in the world of prosecution. We have a whole new breed of DAs that really feel it's important to connect with the treatment community, to partner with local people, and I don't think anybody symbolizes that new breed of district attorneys that get it, that really want to work with you, none other than our district attorney, Madeline Singas.
Okay, good morning. Thank you all for being here. I got a little nervous when Renee started talking about his girlfriend, but I think we're all good. So welcome everyone to our Youth and Mental Health Conference. Thank you to the people at Hofstra, Betsy and Barbara. We couldn't do this without you, so a round of applause, please, to the people at Hofstra. And to all our Long Island Safety Coalition volunteers, to the people in my office, especially Renee, thank you. To our keynote speakers, Dr. Frenari, and our afternoon keynote speaker, Meredith O'Connor. I think you're going to enjoy their presentations very much and find them very informative. And you know, as everyone in this room knows, we're at a transformative time here, and we're talking about mental illness and mental health in a way that we just simply did not, even a decade ago. And it's so important for us to have this conversation, especially when we're talking about our youth and mental health. I'm going to give you some statistics, because when our youngest are affected, our homes are affected, our schools are affected, our future, frankly, is affected. And if we don't do something to act, the problem just gets worse and more ingrained, and it's hard to change a trajectory of someone's life as they get older. Some statistics: according to the U.S. Department of Health and Human Services, 1 in 10 young people has experienced a major depression. Half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before the age of 24. Sadly, less than 20% of children and adolescents with diagnosable mental health problems receive the treatment they need. So of course, like any other illness, early detection is key to treatment. And let's talk about it. And that's why this year we decided to focus on mental health and our youth. And it's not an easy subject, as most of us know, whether it's in the criminal justice system or in our education system or in our homes. These are issues that are not easily solved, but until we have the conversations, we can't hope to solve them. We have so many fantastic panels today, ranging from things that technology and social media, which, you know, I have to say, for all the good that technology brings, for a young person, I have 15-year-old twins, as I know I've talked about before. Their lives are consumed by their phones and technology and social media, and they live their lives very publicly, and everyone knows what's going on, and it's very interesting for me to see the dynamics between kids and how they decide to shame each other or celebrate each other. And everything they do, from what they eat to what mood they're feeling, is, you know, on their phones and in their Snapchats. My kids, I'm constantly catching them, like making stupid faces and just sending them out. And I'm just like, what are you doing? It's just amazing to me. And that ability to connect with thousands of people in an instant, and that permanence sometimes of what they put out there, is really frightening, and adds just a whole other dimension to what they're experiencing. Already adolescence is such a difficult time, and when you add on that you can live it so publicly and everyone knows what's going on, I think just adds the pressure to a degree that most of us probably can't realize, because we didn't grow up that way. We didn't know. I didn't know if people were having parties and I wasn't invited. I had no idea, and I was blissfully ignorant. Now everybody knows if you weren't included. So this generation has only known social media, and it's important that we get to know it and we get to know the impact that it has on our kids. We also have panels that address suicide prevention, eating disorders, concussions, LGBTQ issues. We have a great panel from my office on mental health in the courts by 3 excellent DAs, Pamela Kelly Pincus, who's here, Jacqueline Rosenblum, and Ariane Ryer, to talk about our adolescent diversion parts and our mental health courts, which again, we find that so much of criminal behavior can be attributed to mental health issues. I established just last month a Phoenix program at our office to deal with alternatives to incarceration, and it's an outgrowth of our mental health court, and we're dealing with substance use disorders, veterans, disenfranchised youth dispositions. Again, my goal is to make sure that the public is safe. And how do we do that? We do that by making sure that people's underlying criminality, what causes their underlying criminality, is addressed. And whether that's mental health issues or substance abuse issues, then we're going to do everything we can to make sure that we address those issues, because ultimately our goal is to reduce recidivism and keep the public at large safe. So it's no longer a conversation about how can we put people away for the longest time possible. It's about how can we treat people so that they don't reoffend, and by doing that, ultimately, we're keeping our community safer. So these are some of the things that are going on in the DA's office. You know, we try to stop looking at people at just one issue. This person has substance abuse, this person has mental health, this person has something else, and recognizing that for many people, there's lots of those issues, and the earlier that we can get there, the better. And sometimes mental illness manifests in criminality, and we're the first people that see it, or ultimately the people who can do something about it in a real way. So again, I'm very happy that all of you are here. We couldn't do this work alone. We have to constantly collaborate, work together with our treatment providers, our educators, our community leaders, our schools. We can't do it alone, but it's important for us to have the communication, to network, to know who to call when someone is in distress. We often find that kids with mental health issues often self-medicate. And as a result, they sometimes go down a road of addiction and depression, all before they're in their 20s. So this is an important forum for all of us. I thank you all for your dedication to our children. I think it's going to be a great day. Again, we welcome feedback. Thank you for your consideration. Thank you for your help. And thank you for helping to protect our kids. So thanks very much.
It's just the thing I like about you. Just the thing I like about you.